Hello, everyone. This is Chris Sosa with Becker's Healthcare. Thank you for joining us for today's webinar, AI, Automation, and Analytics, the Core of a Future-Ready Revenue Cycle. Before we begin, I will walk us through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have issues with audio or visuals, please try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I'm pleased to introduce today's speakers. We have Abhijit Godbole, AVP of Provider Services for Sutherland Global. And we also have Abhishek AK, Vice President of Everest Group. Thank you, Abhijit and Abhishek, for being here today. I will now turn the floor over to Abhijit to get us started.
Perfect. Thank you so much, Chris. Good afternoon and welcome, everyone. We appreciate you giving us the time in this afternoon to basically discuss this important topic around AI, automation, and analytics in the RCM space. Like Chris mentioned, my name is Abhijit Godbole. I come with about 25 years of experience in the healthcare revenue cycle space. I've been with Sutherland for about 20 years. I've actually started my career as a biller and a collector, right? So I really understand what goes on in the operations on a day-to-day basis and how labor-intensive these processes really are, right? As much as critical they are for the financial health of the provider organization, we understand the effort that goes behind it, right? And that is really what has driven me towards finding solutions, leveraging AI, automation, and analytics, and really transforming these high-intensive and labor-intensive processes. So again, welcome, everyone. Abhishek, I would like to hand it over to you if you want to quickly introduce yourself.
Thank you, Abhijit. Thank you for inviting me to this webinar. Pleased to collaborate with you. My name is Abhishek AK. I'm Vice President at the firm leading the Industry Solutions Charter, which also includes healthcare payer and providers, which is why in this discussion today, I'm able to bring a cross-industry balanced view across RCM ecosystem. My specific expertise lies in advising enterprises, both payer and providers, with their tech and tech services investment, whilst at the same time reimagining the core business processes in alignment with their business objectives. Good to be part of the discussion, Abhijit.
Perfect, great. So we have a lot of exciting things lined up today.
Yeah.
Go ahead.
Yeah, so we have a lot of exciting things lined up today across introductions. We have already done the evolution of RCM, the pillars of AI, which will be a focus of our study, front, middle, and back office use cases, and the return on AI, where Abhijit and I will provide a lot of context and real-life use cases on how we have seen AI work. And then we'll end it up with some key considerations and Q&A. So let me start with the evolution of RCM for the broader audience which has joined this call. If we go to the next slide, while we will focus on RCM, I thought it is worthwhile to first start with how healthcare providers are operating in dynamic ecosystems, right? And what I say is that healthcare providers are a provider, there are a lot of challenges that they need to navigate. External ecosystem, which comprises some macroeconomic uncertainties, ever-changing payer policies, and regulatory developments. Now, when it comes to macroeconomic uncertainties, one might think, what are the macroeconomic uncertainties are we talking about? So when it comes to tariff impact, while we think that it is impacting only products, you have to realize that providers are actually importing a lot of medical equipment and consumables, which actually impact their margins flow. Also, at the same point in time, as we are aware that ever-changing payer ecosystem policies are also something which impact healthcare providers, along with regulatory developments, the most recent one being the CMS regulatory development on prior authorization, which we'll be talking about. If you compare and contrast the external ecosystem, there is also an internal ecosystem that providers have to navigate through, which comprises of cost to collect pressures, which is going to be the focus of our discussion today, along with challenges when it comes to talent, supply chain, finance and accounting, and IT systems. So what we see over here is that within the internal ecosystem, healthcare providers have to navigate a lot of siloed ecosystems and challenges, whilst at the same time also navigate the external ecosystem. Yet at the same point in time, they have to realize that there are some overarching considerations for healthcare providers, which is patient care, prioritize cost savings in non-clinical areas, and especially for faith-based hospitals, serving the community. So plow back the investments that you are gaining or the cash flows that you're gaining in order to serve the community at large. If we go to the next slide, that's where we are talking about the RCM ecosystem, where we see that the RCM ecosystem is actually the engine behind profitability, cash flow, and experience. So if you see over here, it's the traditional front, mid, and back office, front office for patient access and experience, mid office billing and claims management, and at the end, AR management. Consultation with Abhijit, I was thinking that while these are closely interrelated and interconnected, yet they operate in silos, which actually leads to systemic friction and inefficiencies. Let's take the example of patient access. So in patient access, while the patient access team or department might be prioritizing patient registrations, they might miss out on certain select functions like eligibility or prior authorization checks, which then ultimately impact the end cycle or the back office. Comes to medical billing and coding, they have to navigate both administrative and financial systems, and they might require some documentation which will be there at the front end of the ecosystem. And AR management, as we know, denials management is something which is a very big pain point of all providers. But if you do a root cause analysis of denials management, you see that actually the denials are not because of any mishap or slippages at the back end. The denials are happening because of slippages of the revenue cycle team on the front end and mid end. So while the RCM ecosystem comprises of three functions which are interrelated, there is a lot of friction inefficiencies. Yet at the same point in time, we have to also realize that the RCM ecosystem has to also work with a labyrinth of payers, which comprises of payers, clearing houses, EHRs, EMRs, pay providers, and also patients at the same point in time. So the challenge that CFOs, CEOs, and VP of revenue cycle leaders constantly face is how do we make that the RCM ecosystem works, also navigating the ecosystem constraints. If we go to the next slide, that's where we see the pivot which is happening within the RCM ecosystem, which is now with the advent of technology, we see that RCM is entering the new era, which we are calling as RCM 3.0, which is powered by technology and guided by outcomes. If we take a time series view of how the ecosystem has been evolving, we saw that in RCM 1.0, which I can categorize as maybe the time frame which was pre-COVID era, we saw that RCM was purely about cost savings and some FT outsourcing happening for labor arbitrage, and that also was confined to only onshore. Those VPs of RCM realized that they need to enter into the era of RCM 2.0, which is accelerated cost savings, but at the same point in time, greater infusion of tech. Yet at the same point in time, we have to realize that the tech infusion was only rule-based automation and offshoring. And another interesting example that I can give to my colleagues over here is that within even one of the most efficient or large healthcare system providers, we see that there are so many technology solutions, so many point solutions, which actually are missing the point of RCM, which is actually RCM 3.0, which is the advent of the new RCM era, where RCM actually becomes a strategic differentiator and revenue generator. Now, gone are those days where we talk about point solutions and each ecosystem player having each solution for its specific need. Now, with the advent of tech, especially AI, analytics, automation, RCM is entering the era of RCM native platforms. And most importantly, what we'll be discussing today is that those native platforms are geared to outcomes. An interesting example over here is that we see a lot of software companies also getting into RCM, but they are not actually taking charge of the outcomes. The outcomes still remain with the healthcare provider. But with RCM 3.0 and with the advent of technology and the merging of tech and services, now RCM revenue cycle leaders have the opportunity to also infuse technology to actually guarantee outcomes. And that is some of the things that we'll be discussing in the call today. Abhijit, I think the next section is
I think you covered it. So thank you so much for that. It was a great introduction in terms of how RCM has evolved just from yesteryears where it was labor intensive, outsourcing specific, to more how we are really talking about value driven RCM, right? Where we're looking at not just labor arbitrage and cost saving, but efficiencies that you want to drive across RCM value stream, right? And specifically focusing on outcomes, right? KPI metrics, revenue generation, and things like those. So thank you for covering that. So I think maybe just time to take a quick poll over here just to see what everybody is feeling about, where they are in their AI journey and how they feel obviously within their organizations. Are they ready for it? Are they starting doing something? So maybe we'll just switch over to the audience to see if we can take a quick poll just to get a feedback from what they think. Okay, so here's our polling question. We really want to understand, okay, within your organizations, what is your current use of AI and automation, right? Of course, the topic here is revenue cycle, and that's where we are focusing upon, right? So please feel free, take your time, go ahead and choose your option. We want to understand whether you're exploring potential use cases, where you already implemented certain automation tools, you're a matured AI user, where you've really integrated systems, processes, knowledge management solutions, all of it into a fully digitally transformed RCM process, or basically you're not even exploring or having any AI automation in your system today, right? So take your time. We would love to see your feedback, your polls. What do you think, Abhishek? I think my guess is most organizations probably have implemented some portions of AI automation tools, but would love to get to the whole position of a truly digitally transformed operations, right? So that's my guess, but I'll let you make your pick.
Yeah, so I also believe that the answer would be somewhere A or B, right? So most of the organizations, I believe, would be, again, we've implemented some automation tools, but I don't think many organizations today would have really mature integrated automation strategy. That's something in the works, but let's see how, the insights are. The option C was also something which was quite interesting, that we are actively using AI-driven analytics because we see that, in certain use cases, there are opportunities of using analytics also for point solutions. So let's see what the poll results are. Abhijit, what do you say? B, C?
No, good call out. Good call out on that one, right? Definitely, specifically with an era of patient collections being a significant portion of your revenue cycle nowadays. Okay, how you really drive analytics when you're contacting patients from an outreach perspective, just to basically give them a better experience from a financial, basically better experience from making their payments and things like those, right? So very good call out. I think B or C. I think B. My bet is on B. We'll see.
Yeah.
All right. I think we had some enough polls coming in, and let's just go and see what the results look like. There you go. Bang on. So yes, a lot of organizations are absolutely in that area of having implemented certain automation tools, because I know there have been certain journeys that have started several years back, right? I think about 6, 7, 8 years back, we were speaking about rule-based automation. RPA was a big wave, right? So I'm sure a lot of organizations started deploying some of those solutions, and now I think they're getting ready to talk about AI. So I think, thank you everybody for your feedback. We understand as to in terms of where everybody's standing today, and that definitely gives us good insights. Okay, with that, and that really brings me, what I wanted to focus upon is the pillars of AI, right? So when we talk about pillars of AI, I think a lot of us really think about maybe some large language model, open AI, or basically some NLP-based solution or machine learning and things like those, which is all important, right? All of these solutions are very, very critical in terms of how you deploy these technology solutions within your operations and processes. But what I really want to draw your focus upon is how you want to leverage these solutions within your existing business processes and operations, right? That's where I really define these 4 pillars in terms of how this helps your business operations, right? More than technology, it is really how it really driving efficiencies within your business operations. So the first one I really talk about is basically your digital assistants or your chatbot solutions. Here, the emphasis really is how you're creating or basically leveraging AI to give context-sensitive information to basically your agents, to your associates, to your representatives who are doing the job on a day-to-day basis, right? So how do you make information available to them more quickly? How do you help them real time in terms of when they're actually doing their job, whether they are on a call with the insurance or they're talking to a patient, but how you can really provide that real-time assistance, right? And how AI is really changing that particular process in giving that information to the associates to do the job more effectively, right? So that's one pillar in terms of leveraging AI-based solutions and driving those efficiencies within our day-to-day operations. The second pillar, which is where I think is probably the nirvana in terms of where we want to really go, how we want to really have AI solutions manage everything end to end in an autonomous way or an agility way, right? So how we can drive this with AI or with an orchestrator of a few different AI agents to bring in those efficiencies where AI is doing the job self-sustained and managing the transaction end to end rather than basically having humans involved in certain portions of it, right? So that's the second pillar in terms of whether we have any areas where we can leverage these kind of solutions and how we can drive that within the RCM processes. Third one, of course, is analytics, which you can never get rid of. I think it's very, very critical in terms of monitoring the data, monitoring how analytics is really driving those basically those predictive scores within your operations, how you're leveraging propensity to pay models to not only collect better from insurances, but also collect better from patients, basically predict denials, predict write-offs, and how we can bring those interventions ahead of time in order to avoid those outcomes that have traditionally happened, right? So that continues to be a big focus in driving, basically leveraging analytics algorithms within the revenue cycle space. Last but not the least, like we saw just in the poll where you already invested in certain automation solutions over the years, you've already deployed some of the rule-based workflow platforms or RPA-based solutions and EDI-based solutions within your processes. How do you take that to the next level of evolution, right? Where you're infusing these traditional rule-based automation processes with more AI flavor in it, okay, in order to drive a little bit more autonomous processes, right? Because what you see in RPA were great. When it worked, it really worked. When it broke, basically, then you have to have a whole bunch of technical resources to come in and start fixing in terms of what happened. One website changed, basically threw the RPA off, and basically you had 2 days worth of backlogs that you need to catch up on. So the focus here is how you can make those solutions a little bit more intuitive, a little bit more self-learning, so they're not breaking down the way it used to break down previously, and basically having AI drive some of those interactions, right? So that's really how I define the overall pillars. Okay, but yeah, Abhishek, what do you think before we move on to this thing? I would definitely want to basically show you some examples of what we're doing, what we typically can be done in each of those areas. And the focus really is what Abhishek spoke about, right? Front, middle, and back. That's where we really want to see how we can leverage these solutions.
Yeah. So Abhijit, this is a good point that you made. Like we said, right? It is very crucial to understand each of these levers, and let's get into the use cases over here.
Excellent, perfect. Thank you, Abhishek. So I'll take you through some basically what happens essentially in day-to-day operations in the revenue cycle space, right? So things that you can focus on from a front-end point of view, which is where all your patient access related processes are coming into picture. We'll speak a little bit about your mid-revenue cycle. We'll speak a little bit about your back-end revenue cycle, right? So that's really wanted to be kind of focus upon. Want to kind of share some ideas, share some thoughts, share some use cases which are out there in the market. Some of them obviously are up and running. Some of them are probably getting developed as we speak. But I think these are really how you are looking at driving these AI interventions within your processes, right? So I'll start with what we call the digital front door. Essentially, we all know that basically patient journey really begins even before they're setting foot in a clinic, right? So what we are looking at right now is moving away from fragmented communication channels that were there previously to truly providing patients what we call an omni-channel patient engagement. Right? The focus here is to give the patient their choice, their preference in terms of what they're most comfortable with, whether they want to interact through voice, chat, text, or email. We're leveraging those, giving those options to the patients in order to really engage effectively through those channels. But how do you really make this more seamless, right, in terms of ensuring that when the patient chooses or moves from one channel to the other channel, you're not dropping off the entire conversation. It seems like an easy handoff, and you're ensuring that the patients are really getting what they want, and they don't have to repeat themselves all over again. And basically, the engagement is more continuous from that point of view, right? So that is really the focus, how you basically bring these omni-channel engagement solutions in front of your patient really drives better patient engagement. The next level of evolution after you have deployed some of these omni-channel patient engagement solutions that we're starting to see is leveraging AI to handle those interactions, right? So how do you leverage voice agents to say handle scheduling related inquiries or rescheduling or cancellation related inquiries, right? Basically, when the patient chooses a voice as their mode of communication, you're leveraging these AI agents to have that empathetic based in conversation with the patient. And the AI also takes care of a lot of backend processes to really make sure your EMR is updated with all the data, but it is really driven through an AI voice agent to handle that particular process. Similarly, we are also evolving basically where instead of having basically humans manage some of the chat interactions or SMS interactions or the email interactions that were there in the omnichannel setup previously, we are now looking at deploying AI-based solutions, which is around chat bots, SMS bots, and email bots to handle these interactions to a large extent. What happens with these outcomes essentially is patients get better response, quicker response, they're avoiding hold times and things like those, and basically getting an overall better experience through the whole patient access process, right? So these are some of the patient engagement solutions that we believe will really drive not only digital transformation with your operations, but also truly enhance patient experience while you're really getting them onboarded within your clinics or your facilities. Moving on, I think the second critical step of the process really is how you want to financially clear the patient, right? Prior authorization. I know, Abhishek, you mentioned that the CMS changes that are happening in that area right now. And there's a lot of work in terms of what you can do to financially clear the patient from a prior authorization perspective, right? So a lot of solutions out there which are driving API-based integration with payer portals or certain third-party portals to send and receive prior authorization through a completely automated way, eliminating the need for somebody to submit those requests, follow up on those requests and things like those. It's done through a completely automated process. We're also seeing a lot of AI-driven processes, specifically in services such as surgeries, such as medication, or basically such as medicine-related services, where basically the prior auth request is not extremely cut and dry. It's not like a rule-based process. It requires more interpretation of doctors' orders or referrals or clinical documentation. So that's where an AI really comes in very, very handy, right? Because it's able to interpret all that information that's coming in a referral or an order and submit that information through an automated process to the insurance company to initiate the prior auth, understand basically what is needed to really get that prior auth completed, and then secure that information and financially clear the patient, right? So a lot of very essentially very exciting solutions that are getting deployed in this space, right? So, and what we also believe the way to go about is, as much as you want to make a decision yourself, whether or not a prior auth is required, I still want to get a confirmation from the payer, because I don't want a denial in the back end after the fact and saying that, okay, even I tried, decided that it doesn't need a prior auth, but after the fact that I get a denial, right? So what we're really trying to draw here is, even if it doesn't require a prior auth, we are securing that information from the insurance, having that with us. So if there's a denial, we can leverage that to really go back and appeal, right? Things like those, right? So some lot of exciting stuff, both from patient interactions as well as interactions that are happening with the payers in leveraging AI-based solutions in driving those interactions.
Yeah. So Abhijit, over here, when I see this use cases, one of the use cases which caught my attention, two use cases, if I'm honest, which was outbound AI calls for appointment reminders and patient prep. So you're right? These are game-changing solutions because that call need not be made by a person, right? And sometimes what is also better for an omni-channel experience is that these outbound AI calls are done through a AI agent and maybe through the channel that they want, that the patient wants these reminders to be sent. And I think that is something which is really developing. When it comes to prior authorization, I think the next evolution is, while prior authorization for some payers it used to be happening anyways, but for some of the other payers, they needed to have, like to my earlier point, needed to have a plethora of solutions within their ecosystem. But now with the advent of AI and AI-driven prior authorization, for a provider, it will be increasingly easier to navigate multiple players for multiple members. I think that is also going to be one game-changing solution. What's your thought, Abhijit, on prior authorization? As you know that there are multiple intricacies from payers and providers. You think how this solution will help?
Yeah, so I think a very good point, right, Abhishek? So this is where you really want to leverage the power of AI, right? So the AI, instead of relying on judgments that we used to make previously, now the AI is absolutely accessing the payer information. It understands the rules for each specific payers, and it's basically driving these interventions ahead of time to make sure the need for prior auth and the prior auth initiation process is completed, right, without really depending on any kind of judgment or any kind of a decision that is being made, right? So even if it is not required, it is still getting that confirmation. So I think I go back to that point.
Yeah,
because that's what you want to make sure that the AI, because historically, if you do this with resources, you're spending a lot of cost, a lot of effort to make this happen. But with AI, because you're able to drive these processes a little bit more efficiently, you're able to cover a large volume across your different payers, right? Because you're just feeding in information to your AI for every particular payer, okay, and it will handle it very efficiently for you.
Yep. Okay.
All right, moving on. The second one, HIM, of course, is basically the very critical step of in terms of how you want all the services that are given to the patient and how those gets converted to CPT codes, charges, ICD codes, and everything else. So AI really is bringing its full suite of large language model and natural language NLP processing skills into this particular process, right? Because a lot of this is based on documented information the doctors are putting in their notes. There are results that are coming from labs, radiology, and other services which are getting interpreted. So basically, because of the availability of written documentation, AI really is a very powerful tool in driving autonomous coding solutions across multiple specialties, right? For your outpatient services, for your professional visits, for your clinic visits, autonomous coding solution is really a big game changer in deploying basically these solutions to convert basically your documented notes to CPT codes, ICD codes, modifiers, and things like those. So what we're doing, of course, is trying to achieve to get to a stage where 70-80% of your charts are completely automated from a coding perspective, but still having that coder in review or a coder in the loop process where they're looking at from a compliance perspective, looking at basically ensuring that the AI is monitoring and doing the job thoroughly, right? So we've seen a lot of traction from an adoption perspective across different providers in the ambulatory space, in the acute space as well, right? Where these solutions are driving some significant transformation in terms of just converting your documented notes into codes. There's also a good uplift that we have seen from a revenue perspective deploying these solutions, because what AI is able to help identify is the nuances between specific documentation between providers, and it's able to really pinpoint and say that this ENM code can be applied, right? Even though traditionally a coder would have done it a little bit more conservatively, AI is able to get more precise and basically a little bit more accurate in terms of applying the right ENM codes, basically applying the highest specificity of diagnosis code and driving those basically transactions in a much more efficient way. We also see that AI is helping basically to drive clinical documentation related initiatives within the organization. We're able to give feedback to the providers in terms of how the documentation can be improved, because at every visit level, at every encounter level, AI is really able to go and view the documentation in thoroughness, okay, and basically make recommendations wherever it sees an opportunity from a better documentation point of view, right? So takes away the lift to a large extent from doing these processes manually, where you traditionally probably deployed coders to review charts, review documentation, and come up with a recommendation. Now AI is able to really give you all that information ahead of time, where you can drive those initiatives with your providers from a provider education perspective. Okay, so yeah, a lot of exciting things happening here, of course, and we definitely see a huge impact that this can bring in your revenue cycle process, because coding is very subjective. In a large extent, it's a garbage in, garbage out process, right? So if you're not documenting correctly, if you're not converting codes right correctly, the rest of the backend RCM is significantly impacted. So make sure you arrest it over here, deploy strong AI solutions so that you're getting your bills out correctly and get reimbursed timely.
Yeah, and Abhijit, while you move to the next slide, one of the things over here for medical coding, to my previous point, is staffing shortages, right? I've seen providers struggle with saying that there is a lot of staff turnover for my coding specialists, right? Yep. But with autonomous coding, I think the real value is to your earlier point, right, some of the less complex specialities, right, those can be there, the automation levels can be very high. And whereas the in-house coders for a provider ecosystem can focus on those special complex coding charts. And to your other point, right, do the coding audits and do the coding reviews rather than do the chart or do the heavy lift themselves. I think that's also a very good value opportunity.
Absolutely. Yeah. Lack of resources is where, of course, this will significantly help to make sure that you're not building your backlog and things like those, and you're still working through all the accounts in an effective way, right? So keep churning those bills out.
Yeah.
All right, moving on. We'll spend some time talking about some of the backend processes. I guess, of course, you want to do everything right up front in your patient access areas, in your HIM and coding areas, charge capture areas, so you don't have too much of work in the backend. But the reality is there's always work that happens in the backend, right? So denials will happen, underpayments happen, okay, basically no responses happen. So there's a lot of interaction. And of course, given the era of high deductible health plans, a lot of collections are still happening from patient, right? Which is again retrospective in nature. Even though you want to drive your upfront collection processes to the extent possible, there's still a significant portion of bills that are collected in the backend, right? So, how you're leveraging AI to transform all these interactions between insurance and patients is an extremely important area of focus, right? So, and a lot of interesting work that is starting to happen, right? So, after you get your claims out, basically AI-driven claim scrubbing. Okay, you're basically moving away from the traditional rule-based processes for doing a claim scrubbing, right? So essentially, what the claim scrubbing solution here really does is constantly analyzing your responses that are coming back from the insurance, which is probably your unsolicited responses, your payer denials or rejections that are coming back from the clearinghouse, and it's constantly evolving those rules to make sure that it's staying up to date, right? It's not depending on somebody to really go in and fix that. It's constantly evolving to make sure that next time the same claim doesn't get submitted with the same basically lack of information. It's capturing upfront, so that making sure that there's constant fine tuning in terms of how you send the claims out. So very, very strong solutions to make sure that your first step of the process, okay, is completely comprehensive, done very well, and it's basically learning by itself to ensure it's keeping up to date with payer rules, changes in regulations, and things like those. So a lot of strong solutions in that space. What excites me a lot actually is those insurance voice agents right now, okay, which is where we are deploying AI agents to start navigating and calling insurances, right? I think we've all been there. We've all gone through that. I know there are payer websites. I know there are 276 responses that are out there. Okay, but still payer calls still happen, interactions still happen because lack of information, unclear information that are coming back from the payer, or you just have to basically fight that information that you got back from the payer because you believe it's incorrect, right? So how do you manage that in an effective way is a very, very strong, really basically exciting solution, because we're starting to deploy some of these AI agents which can navigate insurance IVRs very, very effectively. In fact, a lot of times I started to call it in a joking way, right? This is AI agent talking to an AI agent on the other side, right? So maybe it's real to a large extent, but at the same time, it's able to navigate insurance IVRs very effectively. Okay, we all dread that 20, 30 minutes of hold time that is effectively always there. Okay, so AI agents are managing that very, very effectively, right? And making sure that it tracks the hold, and the moment there's an insurance step on the other side, it's able to actually have a real conversation. So the autonomous agentic AI solution that we spoke about, this is actually coming in live action where the entire interaction with the insurance is handled by an AI agent autonomously. It's able to basically negotiate with the insurance agent. It's able to speak to them, capture claim status information, capture denial information, try to get the claim reprocessed. All those interactions are handled autonomously. At the same time, if there is a need for a human involvement, the insurance AI agent can seamlessly get that human involved to continue the conversation to make sure that any complex scenarios are handled effectively, right? And again, the human agent doesn't have to go through the whole process of trying to navigate the IVR or trying to basically go through the whole time and things like those. So significant time savings, significant efficiencies that you can really drive within your operations in terms of deploying these solutions. We've seen a lot of work that has happened on the RPA side with respect to deploying claim status bots, basically bots that can go and submit appeals, or obviously bots that can go and fetch medical records. But then, like I was alluding previously, a lot of these RPA-based solutions constantly broke down because payer websites keep changing their format, keep changing their layout. Okay, so, and then you have to go back and put a technical team to make those changes to the bot, right? So the evolution here really is how we are able to go ahead and deploy AI-based solutions to start making the RPA bots a little bit more self-learning, so that any changes in the website, so we're using what we call more computer vision technology, where the RPA solution knows what to look for rather than it looking for a specific field on the website, right? So that's the evolution that we are starting to see, is some of those basically RPA-based interactions that were happening previously. Okay, of course, on the denial side, it's a lot of action that is happening, right, with respect to deploying agentic AI solutions. And this is where that orchestrated AI agent is coming full to life, right, where we have basically a bunch of three or four different AI agents accessing your SOP documents, accessing payer information, basically accessing your denial information, accessing your next best action, and putting together a comprehensive outcome in terms of how the denial needs to be handled, right? Whether it needs to be appealed, whether it needs to be written off, and it needs to be appealed. We're able to deploy large language models to create those appeals in order to write those specific appeal letters for that account. So you're moving away from those traditional approach of templatized appeal forms, right, where everything was in a template, you're just plugging in patient information and sending it out, to more creating an appeal letter specific for that patient visit, specific for that account, to elaborate why you're appealing and things like those, right? So a lot of exciting work that is happening in the denial-based follow-up, right? And this, again, significant uplift from a revenue perspective that providers are seeing in this particular area. Okay, I'll spend a few minutes. I know we spoke about patient interactions. The same rule applies here. I think how we are leveraging AI agents or voice agents, chat agents, SMS agents to handle patient interactions around patient billing inquiries, trying to make those outbound patient calls to nudge them to make the payment through their preferred channel, preferred methodology, and things like those. We're seeing very, very strong solutions from an agent assist perspective, right? So how you can leverage AI to basically help your resources or help your agents who are interacting with the patients from a real-time knowledge transfer perspective, right? It's basically guiding them, real-time guidance. It's basically helping them coach in terms of what the next best action should be, what the questions you should ask to the patient, how do you resolve that particular inquiry from the patient, so that the real-time guidance comes in because the AI is listening to the actual conversation that the rep is having with the patient and giving those recommendations. It's also helping in summarizing that entire conversation. It's also summarizing basically on behalf of the representative so that it basically saves time, right? So here the focus is how you can effectively serve patient, reduce the handle time, reduce the hold time. You don't want the patient to go through a long IVR before they get to speak to somebody. The AI agents can really come in and start having those interactions right from the minute they are connected, right? So great solutions that we are starting to see even in the patient interaction space.
Yeah. So Vijay, let's move on. I think the next set of questions is very important. Yeah.
Absolutely. So I know we spoke about several different use cases across the revenue cycle. So we want to get your understanding on which area you believe within the revenue cycle process benefits most from AI, automation, and predictive analytics, right? So we'll give you a few minutes to think about it. Again, very, like I said, I think we've presented use cases which are applicable across. But yeah, we were just curious to see where your real problem areas are, where your focus areas in terms of driving efficiencies. All right, what do you think, Abhishek, on this one?
For some reason, again, my answer seems to be B and perhaps A and B. So I think those would be the two areas for me where the maximum benefit can be devised, with the basis where enterprises are today.
What about you? I tend to agree with you on that, because we want to really make sure that your front-end processes are fixed, because back-end is a garbage in, garbage out process again, right? So if you do not have your front-end processes streamlined, then you're obviously seeing a start of a lot of denials in the back-end, and you're just trying to fix or rework things that could have been easily handled upfront. Alrighty, let's see what the results look like.
Go on.
Yep.
Interested. Oh, yes. Ooh,
interesting.
Okay.
Interesting. There you go. Yeah, that's very interesting in terms of what we are seeing, that the focus really is on denial management and appeals, equal in terms of prior authorization and coding. So, no, great results. So I think, again, re-emphasizes our focus area as well. Of course, we're doing a lot of work in the denial management space with respect to leveraging generating AI. So this is great feedback in terms of using this to just fine-tune your AI-based solutions here. Okay.
Interesting results. Let's go ahead.
All right,
this is the big one.
ROAI. This is a specific term that we coined. Okay, just making sure, basically, that we're getting the return on investments. Some of these, of course, require technology investment, resource investment, having the right partner who can deliver this for you, who can build this for you, customize it for your environment and your process and things like those. So it's very critical to understand how you're really driving this. Key considerations that we typically take into account while we're doing this, the overall ROI measurement for AI-related initiatives. Of course, the big focus is on cost takeout, how you're able to drive efficiency, basically processes more efficiently, how you're able to eliminate unnecessary touches, how you can automate low complexity touches. Okay, just driving that cost takeout measure is a great, basically, great measurement, right, in terms of that you want to take it, because you want AI to lead to that, right? So, and of course, it helps basically from better managing your growth, better managing your operations, take out cost to collect and things like those. Revenue enhancement, like Abhishek alluded previously, RCM 3.0, I keep going back to that, right? Saying that this is very, very critical. Not only you want to just eliminate your costs, but you want to make sure that you're collecting every dollar that you owe, right, from insurance or from patients. And you want to make sure that you're collecting those dollars ahead of time and not waiting 90 days, 60 days, 120 days for those collections to happen, because money today is important, right? You want to make sure that you get those dollars in today so that you keep running your operations very, very smoothly, right? And then, of course, a reduction in denials. We spoke about that, very, very critical component. How do you avoiding that? How are you making sure that you're getting ahead of the denials, okay, and ensuring that you're getting those dollars in ahead of time, right? So both speed of payment and the amount of payment are equally important in our point of view, and those are things that you want to measure from your key consideration. Compliance. I spoke about a lot of this thing, outbound phone calls, HIPAA rules, CMSO. We want to make sure your AI is absolutely adhering to all the rules and regulations that are out there. And the way the AI is learning is obviously because we are feeding all that information into that large language model. So it understands when to make a phone call, when not to make a phone call, what information to be revealed, what information should not be revealed based on HIPAA and compliance guidelines. We're able to verify patients through the processes of authenticating the patients and things like those, following our coding guidelines, your basically LCD rules, your NCD rules, your OCE rules, all of them, right? So very, very critical to make sure that the AI is adhering to all the compliance rules. You don't want to be in a position where basically you're in a fix because of AI not doing the job thoroughly. And this is where the human in the loop model becomes very, very, very important, right? Because as much as you want processes to be automated and run autonomously, you want to ensure that basically there's a continuous monitoring from what you have deployed, right? So your AI solutions are essentially monitored exactly the way you would monitor your team members. So you're continuously monitoring them, you're handling exceptions, you're upskilling the AI to make sure it gets more and more fine-tuned. Okay, but this is a very important component. We are not the message here. Obviously, we want to make sure that this is done in conjunction with the humans. Basically, AI is essentially adding more efficiencies to the processes that the humans are handling, right? It's not taking away any processes from them. It's just making their job much more efficient. So one agent can handle actually a lot more transactions than what they were historically handling, right? So that's a huge benefit and outcome that we see. And this is basically we want you to consider while you're deploying and imagining basically AI within your processes. Okay. I know some significant numbers out here. Okay, we kind of tried to outline both what you should measure from a operational improvement perspective as well as from your KPI improvement perspective, right? And I think the way we divide this is you want to measure what your day-to-day outcome from an operations perspective are, basically your productivity improvement, your quality improvement, your turnaround time improvement. At the same time, measure your financial outcomes, right? Basically from an AR days perspective, your liquidation rates perspective, your revenue improvement perspective, your denials perspective, and things like those. So across the front, middle, and back, we're able to really pinpoint and show you what areas you should focus upon from a KPI perspective. And the goal is, of course, to get to these 50% improvement productivity, 90% reduction in no-shows, or over 60% straight to bill ratios when it comes to coding and things like those, right? But it's a journey, right? These are not the numbers that you would get right from day one. Okay, this is a journey that you would typically start working upon and get to this within 90, 120 or like 6 months time frame, right? But it's very critical to define what your operational measurements look like at each step of the process, where you're deploying these AI solutions. Okay, and these operational improvements should eventually drive your KPI improvements, right? From a financial incentive perspective, obviously for your KPI improvements from AR days and things like those, or reduction in bad debts, reduction in write-offs and things like those. So that's a lot of data, a lot of information, but I know this is what we wanted to really kind of go over in terms of how you can measure KPIs and ROI, right? So thoughts, Abhishek, and you, this is something that you monitor quite a bit, right, as part of your discussion with several organizations.
Yeah, I'll just make two quick points over here. What you said about, the financial outcomes, I think that is something which is very crucial. And I think two KPIs that you have mentioned over here, right? Denial overturn rate. I think that is one of the places where some of the participants also suggested, right? That's where they're using AI or the latest and greatest of the technology. We've seen that these KPIs are achievable. Of course, to your point, human in the loop is very crucial. Other thing that you said for AR follow-up, maybe the places to start could be low dollar AR follow-up claims, right?
Yep.
You take away the manual labor away from those and put an agentic solution or an AI-enabled solution, and then you'll see an immediate cash up. So this is very good data points and good reference for the people who are joining the call, that this is what you can hope to achieve with AI. Of course, to Abhijit's point, it's a journey, but with the technology advancements, the journey is getting shorter.
Yep. No, great point on the low dollar, right? Because that's an untouched area for most providers, loss of revenue, very high cost to collect, right? And how you can leverage AI solutions to drive efficiencies there is a great way to look at how you can bring those solutions in your organization. Okay. I think this is time for a quick poll again, right? So I know we went through a lot in terms of, yeah, I know. So basically we want to kind of now understand from the audience, what is your biggest consideration, right, when adopting AI or automation revenue cycle, right? Is it basically data and compliance? Is it basically just empathetic patient interactions, managing change and staff, okay, achieving basically the measurable ROI, or just overall integration with your existing system? What is really on top of your mind when you want to start leveraging some of these solutions within your organization? My question, all of the above. I don't think we have that. We have that as an option here, but yeah. Absolutely, I would love to hear from everyone in terms of what is on top of your mind. We'll give them about 10 more seconds. Then I think we just have enough time to take some question and answers after that. I think we're almost coming towards the end of our presentation here.
Yeah.
All right. Are you ready to reveal, Abhishek? Let's move.
Yeah.
Excellent. All right. Measurable ROI and compliance and data. I mean, evenly spread, of course. Yes, data accuracy and compliance, very, very critical. I think we all recognize that everything needs to be done with all the regulations in mind. You make sure that you're adhering to HIPAA, CMS, and all those guidelines. But yeah, equally important is to measure ROI, how you're driving ROI within your operations by deploying this AI-based solution. So I am surprised to see empathetic patient interactions. I think that was also top of the mind for a lot of providers, but I believe it's still very important when you're driving obviously those interactions with your patients to just reach them where they are. But I think, yeah, as expected, it's a fair mix of equal importance to all aspects when you're basically trying to leverage these AI solutions with your organization.
Yeah. And I think the interesting thing over here is that every organization is at different parts of their journey. So which is why the answers will also be slightly different.
That is so true. That is so true. Good point, Abhishek. Yeah. Okay. I know very complicated slide. Okay. But this is essentially what we wanted to show you in terms of what we're doing here at Sutherland to deploy this AI-based solutions across the RCM value stream, right? So the 4 pillars that I spoke about, again, basically the way we are deploying these solutions are very system agnostic. We have a lot of workflow solutions that we have built across the value stream, front, middle, and back. Okay, and in the middle is what you see the entire tech stack, right? From a data perspective, from AI tools perspective, what kind of AI tools you're leveraging, how you're bringing your knowledge management solutions together, how you're leveraging your prompt engineering, right? So this is a comprehensive view of how this all comes together, which is fully integrated with your workflow platforms. It could be your billing systems, or you might have your own workflow platforms internally that you have built. It can be very easily integrated with that, and that's how you drive all those outcomes from a transformation perspective, right? The first set of outcomes are your digital assistants, then your autonomous, basically AI agents, your analytics AI agents, and then basically your intelligent automation, right? So this is just to give you a full view, saying that this is all done. It's very essentially from a implementation point of view, it does require a little bit of effort, but you just have to get your systems and processes together, and this can be really up and running. With the way technologies evolve, it gets up and running very soon, right? So just want to leave you with thought in terms of how you want to really deploy this within your operations, in terms of how you start to design some of these solutions for yourself. All right, perfect. Maybe we are just in time for some Q&A. So love to hear from everyone, your thoughts, questions, any questions that you have. Would love to take some questions from the audience and provide us thought processes and things like those. So.
Great, thanks, Abhijit. Yeah, we do have about 10 minutes, not quite, for everyone to send in their questions still. Thank you so much for all your participation. Of course, thank you, Abhijit and Abhishek, for that wonderful presentation. Let's get started with the first question then. So for Abhishek, this is for you. And it is, how do you orchestrate the change management component of AI adoption?
Oh, lovely question. So we talked about, how AI is going to be transforming RCM. I think you can look at transformation in three aspects, right? And change management also in three aspects. One is people, process, and tech. And while I would say that, process and technology, there are advancements, at the end of the day, the people change management issue is very crucial. And that's where I've seen many providers actually struggling with. And some of the places where I think that they miss out on actually realizing the full effects or the full benefits of AI is not keeping the staff informed and involved in the decision making when AI is being implemented or even being introduced. And I think that is one very crucial aspect of change management. As I see it, I think how change management needs to be navigated is not the responsibility of the HR function within a provider, nor is it the responsibility of the VP of RCM. I think this is a CEO level responsibility, a CFO level responsibility in order to orchestrate change. That means, effective communication plan, and to my earlier point, involvement of each of the functions of the RCM straight at the get-go in the design phase, rather than implementing a solution and then throwing it to the VP of to the RCM teams in order to execute. Also, at the same point in time, for change management, one of the things, Abhijit, I feel which is crucial is, the effectiveness of KPI redesigning. So no longer would be those days where you say, okay, how many charts did a person code? How many claims did they process? It needs to be transformed into a way looking and incentivizing how many charts did you code with the help of AI? How many charts did you review, or how many edits did you do so that you could help the AI tool become better, faster? I think that's how people need to be incentivized. And if I can take a leap of faith, once that incentive mechanism is put in place, maybe you need to disincentivize folks also when they are using when they are not using AI for some tasks which can be routinely automated. Of course, at the end of the day, it's not an easy journey, but I would believe that, starting at the CEO level and having very clear communication and also governance plans, I think that's very crucial for change management access. Thank you for this question.
Excellent. Thanks, Abhishek. Next, we have a question for you, Abhijit, and that is, how do you prioritize what use cases to go after first?
Excellent question. So I know I spoke about the end-to-end RCM transformation over here, but for me, I think the way you would really prioritize first, of course, you want to understand what your biggest problem areas are, and which is where you really have the biggest leakage, right? For some organizations, probably coding. For some of organizations, probably prior authorization, and for some organizations, back-end revenue cycle, because your front-end processes are working very well. So there is an element of you doing that analytics from a data point of view to understand where the biggest need is. But if I have to just pull something out of my head and throw out an answer, I would really focus on the front-end processes, right? Because I keep alluding to this, like RCM is a garbage in, garbage out process. If you do not have your upfront processes corrected and you're throwing garbage in the back end, you're just fixing problems over and over again, right? So I would really focus on maybe coding as a big use case, because I think large language models are doing some significant work in that particular aspect. Of course, very compliant solution from a HIPAA and CMS guidelines perspective, and I think even the prior authorization, right? I think those are some of the areas that I would focus upon, just to make sure that your upfront processes are streamlined, and then you focus on what the residual is in the back end to catch up on things that are probably not fixed even after you've deployed the solutions upfront, right? So that's the way I would look at it.
Got it. Thanks so much, Abhijit. Yeah, would you, everyone out there in the audience, would you have another 5 minutes or so to answer questions? So please let us know if you have questions. Next, gentlemen, I do have one for you, also from the audience. So how is your organization differentiating between AI vendors who have real PHI compliant solutions versus the more recent niche AI vendors with point solutions? There's a follow-up to this. That is a platform approach or point solution vendor approach better from your perspective? A lot to unpack there, guys.
Yeah. Abhishek, you want to take that, and I can probably fill in later?
Yeah, it's a very interesting question, right? Now, how I would see it is that, how do you differentiate between AI vendors who have real PHI compliant solutions versus niche vendors? So I think both have a place in the market. Of course, it depends on what your specific needs are. The only drawback that I see with niche vendors or with niche vendors having point solutions is that the overarching considerations of having revenue efficiencies across are not met, right? In fact, it might lead to even add to the inefficiencies that you are having in revenue cycle management. That at the same point in time, if a provider ecosystem has a good stack in place and there are some point solutions which are required in order to have a comprehensive platform, then I think point solutions approach is also beneficial. But if you give me a preference, I think then an end-to-end platform approach, because then you can really, take charge of the outcomes. Otherwise, what might happen is, again, to our earlier point, each department within the revenue cycle management function will try to chase their own efficiencies and KPIs, which is why a platform-driven approach is better. And as we know that Sutherland, amongst other providers, are providing business platform solutions. That means they're taking care of outcomes. And I think that is what we need to derive from any agentic solution or technology solution that we are implementing. What do you think, Abhijit?
No, I think very, very well articulated, Abhishek. Yeah, I think I was alluding towards the same thing, right? So you need what you really need from your partners essentially is what we call delivery assurance, right? Saying that it is not just deploying a piece of technology to do certain things and you're trying to figure it out as to how that works, or basically just giving the solution for basically deploying certain point solution. Of course, all of this needs to be well orchestrated within your technology solutions, but having a partner who can work with you and basically customize these solutions for your specific needs, your organizational requirements is very, very critical. And basically this partner should be able to assure you delivery outcomes, right? In terms of, I'm going to change these outcomes, these behaviors and things like those. So it's a very, very critical aspect of you making the decision as to whom you go with.
Great.
Awesome.
Got it. Thank you so much, gentlemen.
Yeah.
Oh, yeah. We can probably squeeze in one more. Let's go with this. So, Abhijit, in your experience, which use case has the biggest ROI?
Again,
for both of you, whoever wants to answer.
I'm biased towards. I don't know. I keep going back to scenario. I think every case has some significant ROI, right? Every. I think it's obviously important to measure what ROI is important for you, whether it is cost reduction, whether it is revenue enhancement, or it is just basically compliant processes, right? So again, the answer would differ in terms of what your real priorities are. I keep alluding towards the front-end processes. I think we have seen a significant ROI when deploying AI-based solution in the coding space and things like those, right? And that's an area we're really prioritizing to transform, because we believe that once you fix that, there's a lot of back-end processes that get fixed by itself, right? So a significant investment that are going in just leveraging those solutions in the giant space.
Gentlemen, this has been a terrific presentation. Thank you so much for being here today. We, of course, want to thank the audience for all your participation. Please know that if we did not get to your question, we'll reach out to you after the presentation offline. All right. Thank you so much to Sutherland Global for sponsoring today's presentation. We hope you all have a wonderful rest of your day.
Perfect. Thank you so much. Have a good afternoon, everyone. Thank you.